Continue working with the Ministry of Health, with the other partners, Mackay University.
Dr. Kiiza Besigye has embraced the presidential guidelines towards preventing the widespread of COVID-19 in the country, although there are still some gaps. Besigye, however, was in the same somber state with Ugandans for not attending the mass gathering at Namugongo Shrines this year, but he wished Ugandans a happy Mother's Day celebrations. Uganda records over 80 patients who have recovered from COVID-19, which vote of thanks goes to the health sector, most especially doctors and nurses at the front line. Dr. Kiiza Besigye says, although Minister of Health deserves a big applause in its work towards fighting coronavirus, emphasis should be prioritizing the strength of health sector if Uganda is to fight COVID-19 successfully.
People who could listen to follow the standard procedures that had been laid out to reduce the spread of the pandemic. We totally supported the measures that were rolled out to stop the spread of the virus, to reduce the speed at which it spreads.
By following the presidential guidelines towards restraining the rapid spread of coronavirus, Besigye says there is need for post-lockdown relief to Ugandans in terms of food, water bills and electricity, among other needs.
Nobody had prepared for it. The greatest majority of Ugandans indeed live hand to mouth. So how are their lives going to come back? If people must wash their hands many times with soap, how will they wash when they are worried about the water bills? Rent. The greatest majority of our people live in rented quarters.
However, he faulted security organs on the brutal conduct towards Ugandans ever since the outbreak of COVID-19.
Beating innocent women, carrying fruits on their heads, trying to fend for their families.
Besigye was also concerned with the way Kampala Capital City Authority is handling the issue of transport in Kampala, which at the end will affect border and taxi drivers.
That plan, to be effective, must have involved all concerned. It must be highly consultative. You must consult the borders. How shall we proceed? You must consult the taxi drivers. You must consult the market vendors. You must consult the Batembe.
This meeting was attended by party members, among other delegates, Namamonde Deborah and Gloria Guitabingi, UBC News.